meeting is being recorded.
Hello, I'm Betty Casey, editor of Tulsa Kids Magazine. We've partnered with the Children's Hospital at St. Francis to bring you PJ's Corner, which gives you important health information to help you in your parenting journey. All interviews in the series are available online and in print. You can just look for PJ's Corner. Today, we're talking with Dr. Emily Williams, an MD with Warren Clinic and St. Francis Children's Physicians Dermatology, about children and skin issues, especially in the winter, so with the dry air. So Dr. Williams, welcome.
Thank you so much for having me.
Tell us, what are some common skin issues that children experience in the winter months and what causes them?
Absolutely. So as you kind of alluded to, we do see a lot more dry skin in the winter months, especially here in Oklahoma where the air can get a little less humid during the winter and we don't have quite as much of that moisture helping our skin keep nice and smooth. So for kids with eczema, this may affect them a little bit more, but we do see this in all kids. And it comes even, probably more so in January, February when our months are the driest and we're tending to use heaters more often and even more warm water.
Okay, so you mentioned eczema. Can you tell us what that is? I don't know what that is.
Absolutely. So eczema is a skin condition that can affect anyone, but it can affect kids sometimes more often than adults. Basically, it is where kids have a little bit more sensitivity in their skin and they have some itching that correlates with dryness. And so it is a condition that is specific to the skin. It tends to affect areas of skin folds like where our elbows are and behind of our knees. It's something that some kids may grow out of, so we see it more commonly in the toddler to like early preschool ages.
Okay, all right. So you talked about rashes, or what do the conditions look like, and what are the symptoms?
Absolutely. So one of the things that parents may notice first is that their kids just tend to be scratching. And sometimes what happens is that they're feeling itchy before a rash appears. And so when they feel itchy, they tend to scratch. And then you can see some redness, maybe some kind of flaking or scaling. And sometimes it can get as bad to see even a little bit of skin breakdown just where we've scratched a little bit more. But that's something for parents to look out for. And sometimes the kiddo may not be able to tell you that they're feeling itchy, but just seeing them scratching should be a good telltale sign. Other things, if you're wondering if your kid's skin is more dry than it should be, is we'll see more a little bit of some of the cracking, or it'll look a little bit more scaly than normal.
Okay, what can parents do to avoid or minimize these winter skin issues?
Absolutely. This is going to be the core of the best practices for winter skincare, but all of these do apply year round too. So as we're using heaters and things more frequently, we just want to be very good about keeping moisturizers on the skin. What I typically do recommend to patients is to get something at least that says moisturizing cream. The best thing is an ointment, but we want to make sure it's at least a cream. Lotions tend to be a little bit more thin and they don't give you as durable of a moisturization. Creams and ointments typically come in something that's going to be more of a tub versus something that you can pump in a bottle. The most important time to apply it is going to be after bathing, when your skin is going to be the most soft and it'll kind of soak in even better. And then speaking of bathing, we want to be really careful with bath time or shower time in that we don't want to use hot water. We want to use lukewarm water. We don't want to prolong the water exposure because all of that can be a little bit dehydrating to the skin. And then you really only have to apply soap where visibly dirty, especially in the winter time when we're maybe not playing outside as much. There's not going to be as much soil or things on the skin. Really just maybe in skin folds in the private areas applying soaps. And then speaking of soaps, as a rule of thumb, we like to use soaps that have minimal fragrances or other ingredients added to them. So we just like to keep our skincare as plain as possible so that we're not adding things that may compound that irritation.
Okay, so no fragrance, no extra scents, no extra stuff. We may
Exactly.
like the smell, but that's probably not great for our skin. Okay.
Absolutely.
So if children do develop these conditions or have this itchiness, what kinds of treatment are available to us at home and maybe as a doctor?
Yeah, very good question. The best thing to start with at home is just going to be kind of those practices that we just went over, making sure that we're staying really well moisturized because, as we tell patients, dry skin is itchy skin. And so, if they're already itchy and then their skin is dry, then we want to make sure that we're staying as on top of moisturizer as we're able to. But if we feel like we're optimizing what we can do at home, or if it's affecting sleep, whether nap time or kids getting through the night without scratching, or if it just seems like a little bit above and beyond normal, if you're seeing rash on the skin, those are all great reasons to call either your child's pediatrician or us over at our dermatology clinic. And then we can take a look in person and just make sure that we're doing it the best that we can and offer different treatments. Sometimes we need a little bit of an anti-inflammatory medicine on the skin, whether it's a topical steroid or another form of a medicine, just to help calm that skin's reaction down.
Okay. So at a doctor's office, that type of cream would be something they would get through prescription then. It
Yes,
wouldn't
ma'am.
be okay. So yes, that was my last question is when should we call a doctor about this? So anytime we're concerned about too much itching or it gets in the way of sleep or normal daily behavior, then probably it's time to call the doctor.
Yes, ma'am. And then if there's ever any kind of yellow crusting or anything overlying any of their itchy spots, those are all great reasons to come see us. But I always tell patients any parental concern is good enough for me. And so this is really a partnership where we want to make sure that we're addressing all concerns possible.
I do have a final question. If we see these dry skin issues or we see some kinds of problems with our child's skin, could it be caused by something else other than dry skin?
Absolutely, it can. And the list of that is going to be from things that are more common to things that are less common. And it's not anything I would want parents to worry about, but that's what we're here for to make sure that those things aren't going on. So, if it's not responding to the treatments that we prescribe or that maybe the kind of first line treatments, then those are all reasons that we want to reevaluate and see if there might be something else that we need to address.
So yeah, so any concerns that we have as a parent, we should call our doctor, call the child's pediatrician, and make sure that everything's okay.
Absolutely. It's a world of a lot of information, and while that can be helpful, sometimes it can be really confusing for parents to sift through what they need to do or what they need to know. And that's where we come in just to kind of step along and partner with you.
Great, thank you. Okay, thank you, Dr. Williams. I appreciate you taking the time today. I also want to thank the Children's Hospital at St. Francis and remind our viewers or readers that they can look for PJ's Corner in Tulsa Kids Magazine or on our website to find all of our PJ's Corner interviews. So thank you again for the information. It was great. We'll try to keep our skin moisturized for the winter.
Thank you so much for having me.